The thing I think that you forget very quickly once you start using a computerized ICU system is that you start dealing much more with facts rather than hearsay. I think that the experience I had before, my junior doctors would often transcribe at great length handover sheets, and these became a sort of enshrined Chinese whispers, so that they'll say that the patient had a coronary bypass graft in 1987, and that will become 1989, and then it'll become something else, and you're never quite sure what it is. Now you can refer back to the notes, but actually you end up having to dig through to find these things. And what using ICCA allows us to do is to make sure that we put the information in once, and if you put it in once, it's much easier to put in the effort it requires to make sure that information is accurate. And if there are inaccuracies, you change it, but you're working off the best information that you can, rather than, as I say, than hearsay. It improves your access to the lab results and observations obtained to a patient. So again, instead of a 3-hour-old number which a doctor did on a sort of handover ward round or picked up at midnight and is telling you at 8 a.m, you can look at the system and you get the up-to-date information. And I think working in closer to real time with accurate data inevitably improves the quality of what you do. When in the past, using paper notes and handover sheets and things, you weren't aware at the time that you were using a piece of incorrect information. It's only down the line, potentially when things have gone wrong, that you become aware of that. And it's always a very unpleasant and painful discovery that you've been told something that's a complete fabrication. So I think that sort of imperceptible change is probably the biggest benefit.